Okay, guys, this is our second video on hematological dysfunction. So last time we were talking about red blood cells. So now we are going to do one quick thing on iron overload or hemochromatosis, and then we're going to go into white blood cell dysfunction. So, iron overload. Now remember, in order to hemoglobin, we need iron. But the amount of iron we need has to be kept in balance, and that is taken care of by the liver. And so what can happen sometimes is individuals can have an excessive absorption of iron. In most cases, this is genetic. And so what happens is there's a lack of control over iron absorption by the body, either at the level of a gene that is dysfunctioning for iron transport, or a change in a hormone level that helps regulate how much iron is absorbed by the body. The problem becomes that excess iron is deposited in certain spots, like joints, which obviously would cause a lot of pain, in the liver, and certain endocrine organs. Things like the pancreas can affect some of the reproductive organs. So obviously, if iron's depositing in the joints, it can cause a lot of pain and changes in mobility. If you have iron depositing in the liver, it can cause change to the way the liver functions, including failure. And then, of course, if you have iron settling in the pancreas, it could lead to diabetes, diabetic-like symptoms. And then other endocrine glands, places like the reproductive organs, it could cause things like impotence and decreased sex drive. The solution for this is phlebotomy of whole blood to reduce overall the amount of iron circulating in the bloodstream. Okay. So the next thing we want to talk about is changes to leukocyte function. So when we're talking about leukocytes, okay, or white blood cells, their job, remember, we want to remember always the correct function and then what happens when it breaks down. So their correct function is to fight infection. So when someone is sick, you would expect that their white cell count would go up, and that's a normal, leukocytosis is a normal part of infection. When someone has leukopenia, it means that they have a low white blood cell count. An exceptionally low level, less than 1,000 per microliter, is not normal, and that will put you at an increased risk of infection. So how could this happen? So you want to think to yourself, how would someone's white cell count drop? And the two things that pop to my mind almost immediately would be radiation and chemo, which is why these treatments for cancer put the patient at significant risk for infection the longer they're on the treatment. Okay. Then there are other immunodeficiencies, some of the ones we discussed in our immune system lectures, that can also lead to leukopenia. But using radiation and chemo as treatments for different forms of cancer is not ideal in many regards, but this is a big regard. You can imagine that if someone's having chemo, right, long-term for whatever cancer that they have, and develops leukopenia, then you have to kind of weigh out, continue to give them chemotherapy, understanding that this very low white cell count is putting them at significant risk for all types of infections, including things like your run-of-the-mill bacterial infections. Okay, so some issues associated with white cell dysfunction. The first one we're going to cover is mono. Okay, mononucleosis is a viral infection. It's caused by the EBV, the Epstein-Barr virus, which we talked about a little bit when we did we talked about different types of viruses back when we did immune function. Mono is benign, it is acute. So it's not a chronic infection, it's an acute infection. What happens when someone has mono is specifically you have an acute infection of the B cells, which, remember when we talked about white blood cells, these are a type of lymphocyte. So it's not attacking all the white blood cells. This infection is specifically targeting the B cell population. Okay, so what happens when someone has mono? What are some of the signs and symptoms? So sore throat, fatigue. And this is a big one. The fatigue can last anywhere from 4 to 6 weeks. Sometimes people develop swollen lymph nodes and flu-like symptoms associated with mono. Okay, so a couple of things. Many people carry a latent subclinical form of Epstein-Barr virus and they're not sick with mono. The incubation period for mono is about a month. Okay, recovery time for mono really depends on several factors. For some people, they recover within 4 weeks, and other people, the fatigue can last upwards to 2 months. The treatment for mono is simply rest, analgesics, and antipyretics. Now, one thing that can be a sidebar, another outcome from mono, is sometimes people have an enlarged spleen, and because of that, sometimes those patients are treated a little bit differently because, the spleen, which you remember from AMP2, I hope, is very loose reticular connective tissue. So if you have something enlarged, it's very loose tissue, then the challenge there is making sure that it's not bumped or hurt in any way that the spleen could rupture. Okay, leukemia. Okay, so this is a clonal malignant disorder of the bone marrow. What happens when a patient has leukemia is they get very rapid proliferation of malignant leukocytes. So what you're producing is, in the simple language, is cancerous white blood cells. It's classified 2 ways: the cell of origin, which cell are we talking about, and then the rate of progression. So, for example, if you have something that's acute versus chronic, the terms mean something slightly different. When you're talking about leukemia, acute means it's in an immature form of a white blood cell, and chronic is in the more mature form of the white blood cell. Okay, so again, it's the terms we've used very often, but used in a slightly different context here. There are 4 general types. So for example, you have something like ALL, which is acute lymphocytic leukemia, and then you have something like CLL, which is chronic lymphocytic leukemia. ALL is the one that's extremely aggressive. When someone has acute lymphocytic leukemia, that tends to be a very aggressive form of leukemia. Something like CLL, chronic lymphocytic leukemia, sometimes the symptoms are very mild, the outcomes are not quite as severe, and sometimes the treatment for CLL is simply watch and wait, that they don't really treat it all that aggressively. Now, obviously, if someone's producing a whole lot of white blood cells, but they're ineffective, they are still very open to infection. Okay, now because this is a bone marrow issue really at the top, right? It's a clonal malignancy of bone marrow. You're going to have outcomes associated with it that on paper don't look like something a white blood cell would take care of. So for example, if you look in the notes, it says some of the clinical signs would be anemia and bleeding issues, but that's connected to the fact that if it's really the bone marrow that's creating our challenges, it also does produce red blood cells, and it also does produce platelets. So if those cells are also ineffective, the outcomes would be anemia and a risk for bleeding. Obviously, someone would be at high risk for infection because the white blood cells that they're producing are not effective at all. Okay, how is this diagnosed? Usually through blood counts and then sometimes an examination of the bone marrow. The treatment, okay, so treatment for leukemia, there's many different treatment options. I'm just going to give you the general broad categories. So All right, so chemotherapy would be an option, okay? Sometimes if someone has a very aggressive form of leukemia, you might give chemotherapy very aggressively over a long time frame. Sometimes that chemo would be IV chemotherapy, and sometimes it could be oral chemotherapy. It really depends on the type of leukemia your patient has, their overall health, the age of the patient, etc. And then there's some that are what's called AB, I'm just going to use for antibody targeted chemo. Okay, so there are different options there. Rituxan, I believe, is an antibody-targeted chemo as well. So for some individuals, the chemo for leukemia will be given for a very long time, and some for a shorter period of time. For some forms of chemotherapy, it might be simply watch and wait and just kind of treat infections as they arise. Okay, the next video will cover changes to lymphoid function.